Hi, I'm Dr. Leila, a California board family and cosmetic dentist, and proud to say now an airway-focused dentist, which has become my true passion. And today we want to dedicate this episode to Autism Acceptance and Awareness Month and how inclusion plays a role in dentistry. And what better way than to bring the two most amazing souls that I know that have a huge space in regards to this here at LH. Our pediatric dentist, Dr. Simran Sura, who focuses on behavioral-led dentistry and has extensive experience treating children with diverse developmental needs, including autism, with a calm, structured, and trust-first approach. Welcome, Dr. Sura.
Thank you so much for having me on this episode, Dr. Leila.
And of course, our lovely hygienist, Yasmeen Arafsha, as an advanced certified autism specialist, with over 14 years of experience in preventative care, who focuses on sensory-aware techniques and helping patients feel comfortable, not just compliant, during treatment. Thank you, lovely Yasmeen.
My pleasure. Thank you so much for having us for this.
And both of them play a critical role in how we care for neurodivergent patients every single day. So let's dive straight in, and I'll start with Dr. Sura. In the spirit of Autism Awareness Month, how can a general dental practice move from standard care to a more universal design approach that naturally welcomes neurodivergent patients?
Thank you for that question, Dr. Leila. So let's start off with the definition of autism. So it's a neurodevelopmental condition, and it's characterized by differences in social interaction, in differences in communication, sensory processing difficulties or disorders, and restrictive or repetitive behaviors. So first of all, it's important we understand that so that we can understand how to tailor our approach to make sure that dental care and access for dental care for these individuals is fair and equal, and we're not creating fear or avoidance when coming to the dentist. So your question was, how can we create this universal design approach and moving from a standard kind of care? So the first thing would be to build predictability. So clear expectations on what to expect when coming to see us and consistent routines. Also reducing the sensory overload in the dental environment, allowing flexible pacing and different communication styles. And finally, involving parents, involving caregivers, involving whoever is usually in the care of this individual, so we can really create an approach that's really tailored to those individuals.
Amazing. Thank you for that. Would you like to share anything, Yasmeen?
I mean, I love all of that. And just to emphasize how important, the environment is. Definitely, environment is everything. And the best way to prepare the environment in a dental clinic is to make sure that we are starting the treatment before the child or the person within the spectrum arrives to the clinic. So basically, there are simple sensory questionnaires that we can convey through a phone call. We can always ask if there are favorite items, comfort items that they want to bring with them. And it's all about being clear and making sure that everything is very known from the beginning. Being, let's say, a person who deals with a lot of patients with anxiety, with phobia, and I'm sure you both can relate to that. Predictability is everything. So if we are sharing our steps early on, we are definitely paving the line for a successful and very comfortable visit, as Dr. Simran mentioned.
Nothing else to add to the environmental changes?
So let's talk about here at LH and why it works so well for us when we see patients, say, for example, with autism. First of all, we have alternative routes to enter to the clinic. We have a side entrance. So say, for example, the waiting room is very, very busy and you've got lots of people. They're on the phone. You've got the radio playing. You've got different perfumes. It can be quite overwhelming, quite a sensory overload. So offering an alternative access into the dental room, that's a great way that we can modify the dental environment. Another thing is the waiting room. So, you can modify the waiting rooms in terms of maybe creating a quiet zone or allowing the patient to wait in the car until the dentist, the nurse, the room is set up and then go straight to the dental room. And finally here, which works really nice for us, is the fact we have an outdoor space. So we have a garden which can be really great to regulate before an appointment, and even during, for movement breaks, for sensory breaks. So these are all adaptations that we've been able to implement in LH Clinic, and we're very lucky to. But there are definitely things that, even if you don't have a garden, things like consistency of space, the same dental room, the same nurse, the same hygienist, the same dentist, the same receptionist greeting you on your way in. So these are all predictable things that we can control to make the visit a lot more calmer and less stressful.
Beautiful. And what would you say we can do prior to the appointment to set up the child for success?
So as Yasmeen mentioned, we have the sensory profile questionnaires that we can involve the parents and the caregivers with, but we can also share pre-visit information with them. So whether that's in the form of photos, a video of, say, Yasmeen's room,
a social story.
Social stories. So things like this, which they all reduce the uncertainty, so you know what to expect. Also gradual exposure. So say maybe just coming to the clinic and a quick greeting, so saying hello, meeting you, meeting me, meeting us, meeting the team, seeing the room. Maybe they don't take a seat, but just seeing what the room looks like. And then the next visit, they're a little bit more comfortable because they recognize us and they recognize the room. So gradual exposure can be really useful. And collaboration. So that's really important, because as a parent, say for example of a child with autism, or as a caregiver or as a therapist involved in the care of that person, you know that person really well. So you know their triggers, their sensory preferences, their motivators. So this is all information that we can pull, and we can use that in the dental appointment. And this is all information we find out beforehand.
And how about during the visit with the non-traditional communication?
Yeah.
Would you like to?
I know we both get excited about that question, because this is where science meets fun, right? So I know people from the outside see it as like maybe luxury stuff, toys. When they walk into our newly decorated hygiene room, they're like, is this the kids' room? But the whole purpose, again, is understanding that with those different spectrums or levels on the spectrum, there's actually a very beautiful quote I want to mention here, is that when you meet one person with autism, you've met one person with autism. They are different, so we're always in need to be prepared to whatever sensory sensitivities that we need to manage. We're either like dimming down the lights, maybe giving them some cool sunglasses, you know, to also help with that bright dental light. We also have our noise cancelling headphones. And sometimes we're offering actually headphones where they can play their own music. One of the things I really love are fidget toys. And I still call them toys, but we can also call them aids, because they are a way to regulate movement, to help a person calm down. I am sure everybody is very, let's say, familiar with the squishy balls, right? The stress balls. Well, there are so many varieties of tools that we can include in the room that would make the appointment much more comfortable. And I mean, there are other like millions of things that we can mention right now. This is why I'm saying it's science meeting a little bit of fun, experimenting with different aids. The weighted blanket, I call it, this big hug that you can use while having the treatment, a warming blanket just to help provide this sense of warmth. So again, this is a topic I think we can dedicate a whole podcast about.
And to be honest, all of us love these things. When I sit in your chair, you use some of these tools, and the weighted blanket on me, I truly enjoyed it.
I mean, that's the point. When you say enjoy it, I wish that every dental appointment becomes this way. People get excited to come in, no matter what, let's say
That's the goal.
Exactly.
And ladies, so parents have anxiety. How do you guys support parents?
So I think, first of all, listening to them, because especially if a child with autism has other comorbidities, perhaps coming to the dentist is not high up on their priority list. Perhaps they have other medical appointments to attend, other children, other responsibilities. So we provide that safe space to listen, and we acknowledge everything that mum and dad will be saying. And we want to work with mum and dad. So we want to make it convenient and as smooth as possible. And we want to be transparent. So about the visit, so they know exactly what to expect, and they can communicate that to whoever they're looking after, whether it's the child or say a family member, so they know exactly what to expect as well. But with parents, with children, children are very attuned to their parents' emotions. Right. So if a parent, and we know there's lots of studies that show if parents have dental anxiety, it can really influence a child's experience in the dental environment. So for us, really discussing everything with the parent, putting the parent at ease, it can directly affect the child. Just as simple as that. So
just something out of the top of my head. Do you prefer the parents to be in the room or out of the room?
That's a great question.
Yeah, I know. I think it's been a debate amongst a lot of pediatric dentists worldwide.
Definitely. It definitely depends on the family, because definitely mum and dad.
What makes them comfortable.
Yes. Yeah. And mum and dad can actually be really supportive. And especially in the age between 2 and 4, we know that, attachment theory is still quite strong. So the child feels more safe and comfortable with the parent anyway. But if a child, you're gauging that perhaps the child is, maybe acting up in front of mum and dad or wants mum and dad's attention,
yes.
Then you can strategically figure out ways to, maybe mummy will just go for a coffee break and come back in a few moments.
Yes.
So it really depends on the family. But definitely with neurodevelopmental children, it's beneficial for the parents to be there. Because they will know, say, when perhaps the child has reached their limit, or perhaps they're just they need a movement break, or perhaps this is just a normal stim that the child does and not to be concerned about it. So they can really help us in helping their child.
Beautiful. So you need their support, and that's always welcomed. And what would you both say for the home? What tools or what help you can have to give parents and the child at home?
I mean, I love everything that Dr. Simran mentioned. The involvement of the parents is one of the strongest keys to success. And this is why we need to understand that when we see them in the clinic, there is no judgment being handed. And we hear that, parents fear that if they bring their kids, they would be judged on how they take care. So once we have that kind of relationship where they're involved in the dental clinic visit, where they are our source of information. What gives my child more comfort sitting here? When did he reach his limit? We would know later on, okay, what to follow up with the home care. Again, I mentioned how much we love, combining science with buying new stuff. So there are so many different tools that we can use to make sure that the progress and the success continues at home. From using different types of toothbrushes. Sometimes we have to start with something that will just, give a nice sensory stimulation, like the sponge sticks. We've talked a lot with Dr. Simran about this. I know the sponge is not considered a brush, but that could be our key to just have the child or the person within the spectrum accept a toothbrush.
Looks like a lollipop.
Exactly.
I like it.
It's a nice way to put it. And we grow from there. We get to understand, okay, anything is better than nothing. This is a slogan, honestly, we love, because it definitely gives credit to the smallest effort done. Our goal is to make sure that we have healthy teeth, a healthy person behind those teeth, and a happy family. So that ripple effect is important. There is also a big consideration we need to give to the types of what we call chemotherapeutics, or in short, toothpaste and mouthwashes. So there is, let's say, a huge preference of flavor-free toothpaste, maybe toothpaste that are, let me put it in a kind way, safe to swallow, just in case that becomes an issue. Non-foaming toothpaste is a huge successful point. And also making sure that, again, with these regular visits, we are able to track with the parents, okay, what are your struggles? How can we make the home care easier? It's as simple as we see them once, twice, 3 times a year. We would love to see them more, but the success is only guaranteed when the home care is easy.
Absolutely.
And we mentioned the social stories.
That's for everybody.
Yeah, and we mentioned the social stories. So something like that can also be applied at home. There are beautiful visual guides that show you the brushing step by step, from opening that cap of the toothpaste to putting the cap back.
Beautiful.
And I'm talking about
step by step,
micro steps. the person, and I'm trying not to say the child, but the person with sensory sensitivities or with certain disabilities, autism, we're talking about autism, can just visualize, okay, I'm at step 1. Now I'm brushing the front teeth. Now I'm doing the back teeth. And this
So
way,
important.
they track everything.
Right.
Exactly. I know we both love the brushing schedules. This
Yes.
is a traditional thing we give as a gift.
Yeah.
It can be also used for adults. But yeah,
Yeah.
I mean,
And I think
Beautiful.
just being aware of the different products available out there, so we
Yes.
can really help guide you.
Right. Because there's
maybe-
so many.
There are so
I'm
many.
lost when I go to the pharmacy these days.
Yeah. So we're happy to guide and to recommend, and then even try to see if this is the right technique for that individual, because we have even 3-sided toothbrushes for individuals perhaps with reduced manual dexterity. And so it just depends on what's best for that person.
Beautiful. And what better people than you guys to have, to see inside their mouth. Let's end with one myth you both want to debunk. Let me start with you, Dr. Sura.
So I'd say the myth that I would like to debunk is that not everybody with autism is the same. Just like all children are different, all people or individuals with autism are different. And it's important for us not to assume that they can't communicate or they can't understand information or retain information, especially if somebody is non-verbal or pre-verbal. We shouldn't just assume based on a diagnosis or a label, and try really hard to understand that individual and the way they're trying to communicate. So the myth that I'm debunking is that people with autism are the same, because that's incorrect.
Thank you. And you, Yasmeen?
so I would say when you come to the dental clinic, success is not doing actually a treatment. I think the success is actually coming to the dental clinic, and it strongly applies to persons with autism. The fact that you were able to make your appointment, even just greet everyone from the door, that is a huge success. That's the first milestone. So the fact that we were not able to drill a fill or start even the simplest exam, that's not a failure. That's actually a huge success that you've had that person reach to a point where they were comfortable enough and felt safe enough to walk into the room, walk into the clinic, and success will follow later.
Beautiful. And my biggest myth is that I'd like to debunk is that inclusion is optional. It is not optional. It is the future of healthcare. Thank you both for today and for your conversation. I hope this, and I'm sure for all the parents and nurses and home carers, everybody, this podcast is something that you have learned a huge amount from. Please follow us for more. And until next time, stay safe, everybody. See you soon.
Thank you.